Now, there has been an outpouring of support and aid for Beirut after the devastating explosion last week. The Canadian government has committed up to $5 million for humanitarian actions in Lebanon. Just 3 days ago, it set up a Lebanon matching fund. So every dollar that Canadians donate to one of the 12 eligible humanitarian organizations is going to be matched by Ottawa. And one of those organizations is Care Canada. On the line with us right now from Ottawa is the CEO of Care Canada, Barbara Grantham. Good afternoon to you.
Hi, Gloria. How are you?
I am well. I guess it's early evening there in Ottawa, but I know that this organization is part of an international NGO. So how long has Care International been working in Lebanon?
We've been in Lebanon on and off for many, many years, but we re-entered in a very active way in about 2013 when the Syrian crisis and the refugee crisis in Lebanon really began to accelerate. So we've been there in this iteration for about 7 years.
I see. And what are you hearing from your counterparts right now about the situation in Beirut? I mean, post-explosion.
Yeah, as you can imagine, it's a pretty desperate situation, and I think it's complicated because it's really a triple crisis. It's an economic and a food crisis even before this explosion because of the economic collapse. Literally thousands of people were really struggling to feed themselves and their families. About 50% of the Lebanese population had been living below the poverty line. It's a refugee crisis because 20% of Lebanon's population are refugees, the majority of them fleeing Syria. And it's now a health crisis because of COVID-19. And so on the top of those three crises, there's now really this layered effect of this absolutely devastating explosion, which is why we're so heartened and frankly overwhelmed with the generosity that Canadians have shown for this appeal over the last week.
That's heartening. Well, you talk about it being a health crisis now, especially the most immediate needs is what I mean post-explosion. Also a housing crisis because of the number of people that have completely lost their homes. So, specifically what kinds of assistance is Care Canada providing now?
Well, the real immediate needs, as you said, are really food and shelter. Although we're also very worried about hygiene and sanitation because of the COVID situation, and the explosion has now really increased people's coming into contact with each other. Our work is really focusing over the last week and in the weeks to come is really focusing on very immediate life-saving aid in the form of food parcels, food packages, psychosocial support, cash, and hygiene materials. And then I think as the longer-term rebuild begins, then things like shelter rehabilitation and longer-term mental health, addressing mental health needs and psychosocial needs and resources to help protect particularly women and girls against gender-based violence will become very, very important.
Well, you talk about all of these intersecting issues, and it just does sound, the interview we did earlier on this afternoon with the professor, with experience in Lebanon as well, the word that kept coming up was dire. And add to that dire scenario the fact that Lebanon, like every other country, is experiencing the COVID-19 pandemic. So far, the cumulative number of infection cases there is more than 7,000. So when that's added into the mix, how does your organization, respond to the pandemic there in addition to the crisis after the explosion?
Yeah. Well, I think, as I said, I think the real priorities at this point are threefold: food, safe shelter, and basic public health and hygiene and sanitation to really try and, to whatever extent it's possible, minimize the spread of COVID-19. As you said, it's a very dire, pretty desperate situation. There's estimated to be well over 300,000 people who are going to be homeless as a result of this. That's bigger than the population of Burnaby. That's a lot of people. But as I said, we've been absolutely moved and touched by the response that that people have shown to us at CARE, but also really to the entire humanitarian coalition and to this matching program that the Government of Canada has put forward. We've had literally thousands of Canadians respond, and it's very heartwarming to see what a generous country this is.
Yeah, it is. So what's your advice then to listeners who do want to donate to this? It's called the Lebanon Matching Fund, right?
Yes. It's there's two ways that you can donate. You can donate directly to any organization, including CARE, that does work overseas, and we will be matched up to that $5 million ceiling, and that will go directly to our partner organization in Lebanon. Or you can donate, as I said, we're part of the Humanitarian Coalition, which is a coalition of 12 of Canada's leading humanitarian organizations. And that's a joint endeavor that we launched a number of years ago, where we come together to raise funds and partner with government in the form of that match and really mobilize folks like you in the media and the business community and individual Canadians. So people can either go to our website or they can go to together.ca and learn more about the coalition, and then we share that pot once the government has matched it and disperse it across our 12 organizations.
Well, and what are some of the challenges when we're looking at the political situation in Lebanon right now? They have the entire cabinet resigning. You have people marching in the streets in protest. How does that complicate getting aid to the people who need it?
Well, I think the situation in Lebanon it's challenging everybody. I think it's difficult for all of the humanitarian organizations, but really our absolute most important concern and focus is on the humanitarian need day by day, and seeing how we can help the hundreds of thousands of people who are suffering. It's the job of others. To look at the broader governmental challenges. Our job really is to focus on the citizens of Lebanon, the refugees and the Lebanese, and to do the very, very best that we can to keep them safe, to keep them fed, and to make sure that they have shelter and a safe place to sleep every night.
Barb Grantham, thank you very much for your time this afternoon.
Thanks, Gloria. It's a pleasure.
That's Barbara Grantham. She is the CEO of CARE Canada. And if you are interested in donating to the Lebanon Matching Fund, you can go to the website humanitariancoalition.ca/crisis in Lebanon. humanitariancoalition.ca/crisis in Lebanon.